and welcome back to English for All, the podcast that turns real life into real English practice. I'm Roxy.
And I'm John. So glad you're here with us today.
Today's topic is one that we all deal with at some point, whether we want to or not.
We are talking about health, going to the doctor, describing how you feel, asking the right questions when you're not feeling your best.
And look, we know this topic can feel a little stressful. Going to see a doctor is already nerve-wracking. Doing it in a foreign language? That's a whole other level.
Exactly. But that's precisely why this episode matters so much. Because in these moments, when you're not feeling well, you really need to communicate clearly. Your health depends on it.
So today, we're going to walk you through everything. How to describe your symptoms, how to talk to a doctor or a pharmacist, how to understand what they're telling you, and how to ask questions when you're unsure.
All through real conversations, real language, the kind of English you'll actually use.
And before we dive in, if this podcast is helping you, please hit subscribe and leave us a comment. It means the world to us, and it helps more learners find the show.
All right, let's get into it. I hope you're feeling good today, but by the end of this episode, your English is going to feel even better.
Let's go!
Okay, let's start the very beginning. Before you even get to the doctor's office, you need to be able to describe how you're feeling. And in English, there are so many ways to do this, from very general to very specific.
The most basic phrase, and honestly, the most useful, is, "I'm not feeling well." Simple, clear, and instantly understood by anyone.
You can build on it. I haven't been feeling well for a few days. I started feeling unwell this morning. I've been feeling off lately. Feeling off is a great informal expression. It means something isn't quite right, but you can't always pinpoint exactly what it is.
Then we get into symptoms. A symptom is a sign that something is wrong with your body, something you feel or notice. Let's go through the most common ones.
A headache, pain in your head. I have a terrible headache. Or, I've had a headache since yesterday afternoon.
A sore throat. When your throat hurts, especially when you swallow. My throat is really sore. I woke up with a sore throat this morning.
A fever, when your body temperature is higher than normal. I think I have a fever. I feel really hot. In many English-speaking countries, a fever starts at around 38 degrees Celsius.
A cough. That reflex action where air is pushed out of the lungs. I've had a dry cough for about a week. Dry means there's no mucus. It's just an irritating, scratchy cough.
Nausea, the feeling that you might vomit. I feel nauseous. Or more casually, I feel sick to my stomach.
Fatigue. Extreme tiredness. Not just, "I'm a bit sleepy." This is a deep exhaustion. I've been feeling completely fatigued. Even after a full night's sleep, I wake up tired.
And a very useful phrase. It hurts when I... followed by the action. It hurts when I swallow. It hurts when I breathe deeply. It hurts when I press here.
That last one, "it hurts when I press here," is something you'd say to a doctor while touching the part of your body that's painful. Very practical.
Now, let's hear all of this come alive. I'm going to play someone who isn't feeling great, and Roxy is going to be a concerned friend asking about it.
"John, you don't look great. Are you okay?"
Honestly, not really. I've been feeling off for the past 3 days. It started with a sore throat, and now I've got a headache and I feel completely drained.
Do you have a fever?
I think so. I checked this morning and it was 38.4. I've also had this dry cough that just won't go away.
That doesn't sound great. Any other symptoms?
I feel nauseous if I eat too much, and everything just aches. My muscles, my back, even my arms. It hurts when I move too quickly.
That sounds like it could be the flu. Have you seen a doctor?
Not yet. I was hoping it would pass, but I think I need to book an appointment.
Definitely. Don't wait on it. You need to get checked out. Perfect. Get checked out. That means to go and see a doctor so they can examine you and tell you what's wrong. You should get that checked out. Very natural and very common.
Everything aches. To ache means a dull, continuous pain. It's different from a sharp pain, which is sudden and intense. My back aches is a low-level, persistent pain. I have a sharp pain in my chest is more sudden and alarming.
I was hoping it would pass. This means you were expecting the problem to go away on its own, without treatment. We all do this, right?
Absolutely. Don't wait on it. Don't delay. Take action now. It's a gentle but firm way to encourage someone to see a doctor sooner rather than later.
Okay, section 2. You've decided to go to the doctor. Great decision. Now, what actually happens when you get there?
First, you'll usually speak to a receptionist. They'll ask you a few basic questions, and you'll need to explain why you're there.
The phrase you need here is, I'd like to make an appointment. If you're calling or coming in advance. Or, if it's urgent, I need to see a doctor as soon as possible.
And they might ask, is it an emergency? An emergency is a serious situation that requires immediate attention, like chest pain, difficulty breathing, or a high fever in a child.
If it's not an emergency but still urgent, you can say, it's not an emergency, but I've been feeling quite unwell for several days, and I'd really like to be seen today if possible.
Polite, clear, gets the message across.
Now, once you're in the room with the doctor, they'll usually start with, what brings you in today? Or, what seems to be the problem? Or even more simply, how can I help you?
These are all invitations to describe your symptoms, and this is your moment to use everything we covered in section 1.
The doctor will then ask follow-up questions. Things like, when did the symptoms start? Have you had this before? Are you taking any medication? Do you have any allergies?
Let's look at those one by one. When did the symptoms start? Your answer? They started about 4 days ago. It came on suddenly yesterday morning. It's been gradual over the past week.
Have you had this before? Yes, I get migraines occasionally. No, this is the first time. I had something similar last winter.
Are you taking any medication? This is important. The doctor needs to know what you're already taking. I take medication for high blood pressure. I've been taking ibuprofen for the pain. I'm not currently on any regular medication.
Do you have any allergies? I'm allergic to penicillin. I have a pollen allergy. Not that I know of. That last one is really natural if you're not sure.
Let's hear the full doctor's appointment now.
Good morning. Come in and take a seat. So, what brings you in today?
Good morning. I've been feeling quite unwell for about 5 days now. It started with a sore throat, and then I developed a fever, a dry cough, and my whole body aches.
I see. And is the fever still present?
It comes and goes. This morning it was around 37.9, but yesterday evening it was up to 38.6.
Okay. Have you had any difficulty breathing?
A little, not severely, but I sometimes feel a bit short of breath when I walk upstairs.
All right. Are you taking any medication at the moment?
Just paracetamol to keep the fever down. And I've been taking some cough syrup, but it doesn't seem to be helping much.
Do you have any known allergies?
Yes, I'm allergic to penicillin.
Good to know, thank you. I'm going to take your temperature and listen to your chest. Can you take a deep breath for me?
Like that?
Perfect. And again? Good. Your lungs sound slightly congested, but there's no sign of a serious infection. Based on your symptoms, it looks like a viral infection, most likely influenza.
So, the flu?
That's right. I'm not going to prescribe antibiotics because viruses don't respond to them. What I'd recommend is rest, plenty of fluids, and continuing with the paracetamol for fever and pain. If your symptoms worsen or don't improve within the next 7 to 10 days, come back and see me.
Should I be worried about the shortness of breath?
Not at this stage, but if it becomes more pronounced, if you're struggling to breathe at rest, or if you feel tightness in your chest, go to A&E straight away.
Understood. Thank you, doctor.
That was such a realistic dialogue. Let's highlight some of the key language.
It comes and goes. This is a brilliant phrase. It means the symptom is not constant. Sometimes it's there, sometimes it disappears. The pain comes and goes. My dizziness comes and goes.
Short of breath. Difficulty breathing. I feel short of breath after climbing the stairs. You can also say breathless or out of breath.
Congested, blocked. Usually used for the nose or lungs. My chest sounds congested. I have a congested nose. You might also hear blocked. My nose is completely blocked.
Prescribe. When a doctor officially recommends and authorizes a medicine for you. The doctor prescribed antibiotics. A prescription is the written document you take to the pharmacy.
Worsen, to get worse. If your symptoms worsen, come back. The opposite is improve, to get better. Two really essential medical words.
And A&E. That stands for accident and emergency. It's what British English speakers call the emergency room. In American English, you'd say the ER. In everyday speech, go to the emergency room right away.
Section 3. The pharmacy. After seeing the doctor, you often need to go to a pharmacy to pick up your medication. And sometimes, for minor issues, you skip the doctor entirely and go straight to the pharmacist.
A pharmacist is a trained professional who can give you advice about minor health issues and recommend over-the-counter medicines. Over-the-counter means medicines you can buy without a prescription.
So let's learn how to have that conversation. The pharmacist might greet you with, "How can I help you today?" Or, "Are you looking for something specific?"
And you might say, "I have a prescription I'd like to fill." Fill a prescription means to get the medicine that the doctor has prescribed.
Or if you don't have a prescription, "I'm looking for something for," followed by your symptom. "I'm looking for something for a headache." "Do you have anything for an upset stomach?" "What would you recommend for a dry cough?"
The pharmacist might ask, "Do you have any allergies? Are you taking any other medication? Is this for yourself or for someone else?"
They might also give you instructions. Take 2 tablets 3 times a day. Don't exceed the recommended dose. Take with food. Avoid alcohol while taking this medication.
Let's break those down. Don't exceed the recommended dose. Don't take more than what is advised. Exceed means to go beyond a limit. The dose is the amount of medicine you take at one time.
Take with food. Swallow the medicine during or after a meal. This often helps to protect your stomach.
Avoid alcohol. Some medications react badly with alcohol. The pharmacist will always warn you if this is the case.
Let's hear a quick pharmacy conversation.
Hi there. How can I help?
"Hi, I have a prescription from my doctor. She prescribed something for a respiratory infection."
Of course. Do you have your prescription card with you?
"Yes, here it is."
Perfect. Thank you. I'll get that ready for you. While I do, Do you have any questions about the medication?
Actually, yes. She mentioned I should take it with food. Does it matter what kind of food?
Nothing specific, just avoid taking it on an empty stomach. A small snack is fine. And make sure you complete the full course, even if you start feeling better before it's finished.
That's important. I always stop taking it too early.
A lot of people do. But stopping early means the infection might not be fully cleared. Are you allergic to anything?
I'm allergic to penicillin, but I told the doctor and she noted it on the prescription.
I can see that, yes. This medication is safe for you. Here you go. Any side effects to look out for?
What kind of side effects might I have?
Possibly some mild nausea in the first couple of days. If you experience anything more severe, like a rash, swelling, or difficulty breathing, stop taking it immediately and seek medical attention.
Got it. Thank you so much.
Take care and feel better soon.
Complete the full course. This is so important and so often ignored. The full course means all of the medicine, even if you feel better. If you stop early, the bacteria can come back stronger.
Side effects. Unwanted effects that a medicine can have on your body, in addition to its main purpose. Common side effects include nausea, dizziness, or drowsiness.
Seek medical attention. Go and see a doctor or nurse. It's a formal phrase, but very commonly used in medical contexts. Seek immediate medical attention if symptoms persist.
Rash. Red, irritated skin. Often a sign of an allergic reaction. I developed a rash after taking the medication. Very important word to know. Section 4. And this one is close to my heart. Because one of the things that gets lost when you're speaking in a second language is the confidence to ask questions.
You understand maybe 70% of what the doctor says, and instead of asking about the other 30%, you just nod and say, okay, and leave without really knowing what's happening.
We've all done it, and in most situations, that's fine. But with your health, you need to understand. You need to ask. You need to advocate for yourself.
To advocate for yourself means to speak up for your own needs, to make sure your voice is heard and your concerns are addressed.
So let's build a toolkit of questions you can use in any medical situation.
Could you explain that again, please? The simplest and most powerful question you can ask. No shame, no embarrassment. Just, could you explain that again, please?
What does that mean exactly? When the doctor uses a medical term you don't understand. You said I have inflammation. What does that mean exactly?
What are my options? Sometimes there's more than one approach to treating something. Asking this shows you're engaged and want to understand your choices.
How long will the recovery take? A very natural and important question. You need to know what to expect.
Are there any side effects I should be aware of? Even if the pharmacist told you, it's completely fine to ask the doctor too.
When should I come back if I'm not improving? This is proactive. You're not waiting for things to get worse. You're setting up a clear plan.
And a really important one. Is this serious? Sometimes we're afraid to ask because we're afraid of the answer, but knowing is always better than not knowing.
Let's hear these in action. John is back at the doctor's. This time, he's asking more questions and being more confident about it. So based on the blood test results, you have a mild iron deficiency. I'd recommend starting an iron supplement.
Sorry, could you explain that again? An iron deficiency?
Of course. Iron is a mineral your body needs to produce red blood cells. When your iron levels are low, your body can't carry oxygen efficiently, which is why you've been feeling so fatigued and short of breath.
That makes sense. And is this serious?
At this stage, it's mild, so nothing to be alarmed about. But if left untreated, it can develop into anemia, which is more problematic.
What are my options for treatment?
The most straightforward approach is an iron supplement, a tablet you take daily. I'd also recommend adjusting your diet, eating more iron-rich foods like red meat, leafy greens, and lentils.
Are there any side effects I should be aware of with the supplement?
Some people experience mild constipation or an upset stomach, especially at the start. Taking it with food and drinking plenty of water usually helps.
How long before I start feeling better?
Most people notice an improvement in energy levels within 4 to 6 weeks, but you'll need to take the supplement for at least 3 months to fully restore your iron levels.
And when should I come back if I'm not improving?
Come and see me in 6 weeks regardless. We'll do another blood test to check your levels. But if your symptoms worsen before then, don't wait. Book an appointment straight away.
Thank you. That's all very clear now. I really appreciate you explaining everything.
That was such a strong example of self-advocacy. Did you notice how John asked multiple questions, and none of them were rude or difficult? They were all polite and natural.
Nothing to be alarmed about. A reassuring phrase doctors use to tell you something isn't dangerous. It's mild, nothing to be alarmed about.
If left untreated, if you don't treat it, if you ignore it. If left untreated, the condition can become more serious.
Iron-rich foods. Foods that contain high levels of iron. Rich, in this context, means containing a lot of something. Vitamin-rich, protein-rich, fiber-rich.
Regardless, no matter what. Come and see me in 6 weeks regardless. Even if you're feeling better, still come.
All right, friends, we're reaching the end of today's episode, and what a rich one it's been.
We covered so much important ground. Let's do a final recap of the key language from today.
From Section 1, describing how you feel. I haven't been feeling well. It hurts when everything aches. I feel nauseous. I've been completely fatigued.
From Section 2, at the doctor's. What brings you in today? It comes and goes. I'm short of breath. The doctor prescribed. If your symptoms worsen, come back.
From Section 3, at the pharmacy. I'd like to fill a prescription. Complete the full course. Side effects. Seek medical attention. Don't exceed the recommended dose.
And from Section 4, advocating for yourself. Could you explain that again? What are my options? Is this serious? How long will the recovery take? When should I come back?
These aren't just words, they are tools. Tools that can help you feel confident and safe in a medical situation in an English-speaking environment.
And remember, even if your English isn't perfect in that moment, even if you're nervous, even if you make a mistake, the doctor's priority is to help you. They want to understand you.
So speak. Use the phrases. Ask the questions. Your health is worth it.
Now, our community question for this week. And this one is personal.
We want to know, what do you do to take care of your health? Do you exercise? Drink lots of water? Get enough sleep? And has there ever been a moment where you had to speak English in a medical situation?
Tell us in the comments. We read every single one, and your stories might just inspire someone else who's listening.
If today's episode helped you, please share it with a friend who's learning English. You never know when this kind of vocabulary might make a real difference in someone's life.
Until next time, take care of yourselves, drink your water, get some rest, and we'll see you in the next episode.
Bye for now.
Bye-bye.